guys, welcome to the Mental Health Podcast. I'm Sulindah Permatasari from the Actuarial Science representing Group V, who will accompany you for the next 20 minutes in the podcast about mental health.
Hi, I'm Dafa Keiko from Electrical Engineering Study Program, and I will answer questions from the questioner.
Okay, introduce myself. My name is Rido Fahmi from Teknik Elektro as questioner.
I am Brema Sembiring from Actuarial Science as questioner.
I am Raditya Mahardika P from Teknik Elektro as questioner.
Why does our group discuss mental health? As we know, mental health is becoming an interesting discussion trend in Indonesia, and also so that in the future Indonesia people are more concerned about someone's mental health. Okay, before we discuss more deeply about mental health itself, it is better if we know first about the definition of mental health.
Okay, Suli, thank you for the question. So, health mental illness is the condition where a person is free from all forms of symptoms, mental disorder. A mentally healthy person can work normally in carrying out his life, especially when adjusting to the problems that will be encountered throughout one's life by using good abilities. Mental health is an important thing that must be considered as a physical health. It is known that the state of mental and physical health stability affects each other. Mental health disorders are not a complaint that is only obtained from the lineage, the demands of life that have an impact on excessive stress will have an impact on mental health disorders that are worse. A simple example is this. You must have experienced something like when you're losing your spirit, you feel your body is weak. Meanwhile, when you are sick, it's hard to just think. Well, this is known as the mind body connection, which means that our thoughts, feelings, beliefs, and attitudes can affect our physical health both positively and negatively. On the other hand, physical health can affect mental health both positive and negative. Well, that's the meaning of mental health.
After hearing the definition of mental health, you must think that our mental health is really important. Okay guys, it's really true. That maintaining mental health is very important because good mental health makes a person think well. This results in focus. Their attention is more focused. People who have poor mental health are easily distracted.
After hearing the definition, I think I understand what mental health is. So, the first question, is there any type of mental illness?
There are more than 200 types of mental illness that a person can experience. However, there are several types of mental illness that are quite common, like number one is anxiety disorder. Anxiety disorder are one of the most common types of mental illness. This disorder can make sufferers feel afraid, excessively anxious, or threatened by when dealing with certain objects or situation. Number two is depression. Depression is also a type of mental illness that often occurs. Depression is classified as a mood disorder that can cause symptoms such as persistent feelings of sadness, hopelessness, and even suicidal ideation. The symptoms can be considered depression if they persist for more than 2 weeks. Number three is ADHD. ADHD stands for Attention Deficit Hyperactivity Disorder. Is the most common type of mental illness that children and can continue into adulthood. People with ADHD tend to be hyperactive and have difficulty maintaining focus on one thing. Number 4 is eating disorder. Eating disorder are a type of mental illness related to food consumption. Sufferers can eat too much or eat too little. Generally, this disorder is related to the sufferer's anxiety related to his weight and body shape. Number 5 is post-traumatic stress disorder. It is a disorder that occurs after a person has experienced a traumatic event such as abuse, war, natural disaster, or serious accident. Number 6 is schizophrenia. Schizophrenia is the type of mental illness that occurs when the sufferer is unable to distinguish reality and his own thoughts. The disorder can cause sufferers to experience unrealistic thoughts, hallucination, and behavioral changes.
What are the characteristics of someone who has a mental health disorder?
There are some common symptoms experienced by someone who has mental health disorder. Mental health disorder can also affect physical health. That is why people with mental health disorder often complain of symptoms that interfere with their lives and work. These symptoms include changes in mood, personality, habits, and withdrawal from the social environment. In general, the characteristic of a person experiencing a mental health disorder are that first, someone with a mental health disorder will feel sad for a long time. Sometimes they will be sad for no apparent reason at all. Then they will not care about the surrounding environment and they will also feel tired quickly. Do not have enthusiasm, and of course, they will experience sleep problems and many more characteristic when someone has mental health disorder.
What are the causes of mental health disorders? Is there any factor that affect mental health?
So there are several causes of mental health disorder. In fact, almost every mental health disorder cannot be known with certainty. In contrast to physical illness, mental health disorder can occur due to various factors or a combination of them. However, in general, the cause of mental health disorder, namely severe and prolonged stress, causes a person to experience mental health disorder, or it is also common for a person to experience events that cause them trauma, continue to experience domestic violence, and have experienced abuse when they were young, and many more. This is the cause of someone experiencing mental health disorder.
So, how do we know if we are mentally fine?
So nowadays people check their mental health a lot using tests on the internet. Actually, not all tools are used for diagnosis. So to check our mental health in the clinic itself, there's a screening tool to see what our current condition is and to give recommendation whether go to psychiatrist for further treatment.
Is there anything we can do to diagnose, and is there any treatment?
The answer is yes, you can. To diagnose the mental illness condition suffered by the patient, the psychiatrist will begin by reviewing the symptoms and complaints felt by the patient or those around the patient, the history of drugs or supplements that consumed by the patient, as well as the history of mental illness in the patient and his family. After that, the psychiatrist will also perform physical, neurological, laboratory, and radiological examination. This is important to rule out the possibility of physical illness that can cause symptoms of mental illness, such as thyroid disease or stroke. If the psychiatrist diagnoses that a patient suffers from mental illness, generally, the treatment that will be given, like number 1 is cognitive behavioral therapy. This is a type of psychotherapy that is done to change and develop the patient mindset and behavior from negative to more positive. This therapy can be given to people with bipolar disorder, depression, anxiety disorder, and schizophrenia. Number two is interpersonal therapy. Interpersonal psychotherapy is done with the aim of improving relationship and the way patients interact with other people, such as partners, family, or friends. Patients will be taught how to empathize and resolve conflicts with others. Number three is dialectical behavior therapy. Generally, this therapy used for patients with borderline personality disorder, but it can also be used for other types of mental illness. This is a type of psychotherapy that is carried out with the aim of helping mental illness patients manage and respond to negative emotion or impulsive behavior. Number four is medicine. In addition to psychotherapy, psychiatrists may also prescribe drugs for mental illness patients. Prescribing these drugs aims to reduce the symptoms felt by the patient, not to cure his mental illness. Mental illness has various forms, although not seen as something that interferes with the function of organs. This condition can cause sufferers not to be able to function and socialize as they should. Mental illness also makes sufferers vulnerable to hurting themselves. Therefore, mental illness needs to diagnose and treat it immediately. Unfortunately, mental illness is often not considered as disease and is even labeled bad by society. This makes people with mental illness ashamed to go to the doctor and suffer even more. In fact, mental illness is not something to be ashamed of. Just like physical illness such as colds or diabetes, mental illness is a common medical problem that can be found and can be treated. So, if you experience symptoms of mental illness as mentioned above, or have relatives who experience it, don't hesitate to consult a psychologist or psychiatrist.
Wow, good explanation, Dafa. But is there anything for us to know if our mental health is fine?
As for us to know if our mental health is fine, that is, first, you feel good about yourself and not overwhelmed by emotions such as fear, anger, love, jealousy, guilt, or anxiety. Have a lasting and satisfying personal relationship, feel comfortable with other people, can laugh at yourself, respect yourself and others despite differences, be able to accept life's disappointment, can meet the demands of life that and deal with problems when they arise, be able to make your own decisions and create your own environment where possible, or adapt if it's necessary.
Is there any factor that affect mental health?
There are several different factors that have been found to affect mental health. Number one is life satisfactions. Reporting from verywellmind.com, a person's ability to enjoy life is often used as an indicator of mental health and well-being. It is often defined as the degree to which a person enjoys the most important aspect of their life. Several factors were found to play an important role in life satisfactions, including absence of feeling of pain, good relationship, sense of belonging, active in work and leisure time, sense of pride and pride, positive self-perception, sense of autonomy, and feelings of hope. Number two is endurance. Endurance is the ability to bounce back from adversity is referred to as resilience. Resilient people tend to have a positive view of their ability to cope with challenges and seek social support when they need it. Those who are more resilient are better able to cope with stress and also thrive, even in the face of it. Number three is support. Social support is very important for good mental health, but loneliness has been shown to have a number of negative health effects. It has problems with physical and mental health problems, including cardiovascular disease, depression, memory problems, drug, alcoholism, and changes in brain function. Decrease negative social support caused by life changes such as going to college, facing social difficulties, changing jobs, or getting divorced can have an impact on mental health. But fortunately, research shows that the number of supportive connections you have is the most important factors in life. It's the quality of the relationship you have that matters. Number four is flexibility. Having rigid expectation can create additional stress. Emotional flexibility may be just as important as cognitive flexibility. Mentally healthy people experience a variety of emotion and allow them to express these feelings. Some people suppress certain feelings and find them unacceptable.
Is there any tips to maintain mental health?
So there are several ways that we can take care of our mental health. Number one is talk about your feelings. Talking about your feelings can help you maintain good mental health and help you deal with times when you get into trouble. Number two is stay active. Regular exercise can boost your self-esteem and can help you concentrate, sleep, and make you feel better. Exercise keeps your brain and vital organs healthy and also provides significant benefits for improving your mental health. Number three is the diet is good. The brain needs a mix of nutrients to stay healthy and work properly. Just like any other organ in your body, a diet that is good for your physical health is also good for your mental health. Number four is no alcohol. Please don't drink alcohol. Alcohol is often an option to change one's mood, but when the drink is finished, you feel worse because of the way alcohol affects your brain and the rest of your body. So, drinking is not a good way to manage difficult feelings. Number five is keep in touch. There's nothing better than meeting someone in person. If it's not possible to meet them, you can also call or message them. Keeping communication open is also important in mental health. The last thing is requests for help. I think it's not the last one, but okay, requests for help. We all get tired of or overwhelmed sometimes about how we feel or when things don't go according to plan. If things are difficult for you, ask for help. Your family or friends may be able to offer practical help or a listening ear. Number six is rest. Mood swings are good for your mental health. This could be a 5-minute break or a lunch break at work or going somewhere new on the weekends. A few minutes is enough to relieve your stress. Do something that you are good at. Doing a hobby or something you're good at can help beat your stress. Doing activities you enjoy and getting promotion will increase your self-esteem. And this is the last thing, is accept yourself. We are all different. It's healthier to accept that we're unique rather than wishing you were like everyone else. Feeling good about yourself increase the confidence to learn new skill, visit new places, and make new friends. Good self-esteem helps you cope when lives get tough. So that's it, guys, for the podcast. Thank you for listening to this 20 minutes podcast, and I hope you guys are helped by this podcast. I'm Dafa Keiko from Group F. Goodbye. Hopefully, we can meet on the next podcast. Thank you, guys. Bye.